just when the number of COVID infections was on a decline and life was trying to get back to normal, India was hit by the second wave. The notorious second wave of coronavirus has already hit Europe, US and UK among others. The daily cases have crossed the 1 lakh mark in India. As India struggles with the rising numbers, the vaccination drive seems to be losing steam. 6 states have reported a shortage of vaccine doses, but Union Health Minister has denied the charge.
डेली बेसिस पर आपके द्वारा खर्च की गई वैक्सीन और उसको रिप्लेनिश करने के लिए यहाँ बहुत डिटेल्ड एनालिसिस लगातार होता है और लगातार जो है आप देख रहे हैं कि हम 16 जनवरी ऑनवर्ड्स ये सारी की सारी वैक्सीन्स जो है आपको उपलब्ध करा रहे हैं.
So where does India's vaccination drive stand? India's vaccination drive is the world's largest. It began on January 16, 2021. It aims to cover 250 million people by July. More than 90 million doses of Covishield and Covaxin have been administered so far. India has also shipped 64 million doses of vaccines to 85 countries. But suddenly, India's own stocks seem to be running dry. Vaccine centers in Maharashtra have been shutting down, turning people away. Vaccine out-of-stock notices are up in some hospitals. Maharashtra has now asked for a minimum of 40 lakh doses to meet the daily target of 4.5 lakh jabs. These states are grappling with the shortage as of now. Maharashtra, Punjab, Chhattisgarh, Odisha, Jharkhand, Andhra Pradesh. Meanwhile, India has temporarily halted export of vaccines. Adar Poonawalla, CEO of Serum Institute, which produces Covishield, has decided to give India's needs a priority during the second wave.
By not opening it up to the private market, we protect the vulnerable and give the priority-based vaccinations. Now, that is good for India and the people of India, perhaps not so good for the vaccine industry, which hopes to make a reasonable profit and return to innovate further, ramp up capacities, and kind of earn the revenues that foreign companies can do. But however, we are working with the government at this stage, at this price point, at this supply point, to take care of Indians first. That is, after all, our priority and responsibility. So, to answer your question, for a temporary period of 2 to 3 months, we have fully accepted the request from the Modi government to maintain this price and to prioritize the supplies to India.
As of April 7, around 85 million doses had been administered across India. The drive was recently extended to include all those aged 45 and above. So what is causing a shortage for Serum Institute? Poonawalla attributes it to US export bans on raw material for manufacturing vaccines.
I publicly said that the US needs to have a global perspective and, not ban raw materials. They might as well be banning their vaccines from being exported, because by banning certain raw materials, companies like myself and many others will not be able to scale up to the extent that we would want to. Fortunately enough, the US ban of raw materials is not affecting Covishield, but it's going to affect Covovax, which is the Novavax candidate, which I'm hoping to start stockpiling from next week.
India has stopped vaccine exports for now. But will it be able to meet its huge domestic demand? Only time will tell.